are there any treatments for COVID-19 to reduce the risk of damage to the lungs?
I think that's
This
a tough one.
This is a tougher one. I know. I go from easy to hard.
You know, I'll phone a friend on these answers, but I think in general, like the science of what's behind the therapy is still evolving. There's a lot of news out there as to what works and what doesn't work. I would say suffice it to say that I do not believe that there's anything definitive. Obviously, if there was, we wouldn't be in this situation. For the present time, I believe that the best supportive therapy is the best we can offer, and that includes a variety of therapies as well. But the promise is there with potentially preventing this with vaccine trials going into the phase 3 status. But I think there's a little work and time to be done, or work to be done, time to pass before we get to a definitive cure for this disease.
I think prevention seems to be the best opportunity to avoid the injury.
Right.
So then would you say, and this actually fits in really well with another question we've got here, is there a correlation between smoking and a higher risk and a more severe impact of COVID with smoking and or asthma, things like that? Should those people be more concerned or more careful?
I think any problem, any health problem with the lungs is going to make a patient more susceptible to a bad outcome with COVID. That being said, you know, this is a pretty stressful time for everyone. So, you know, I don't know how reasonable it is for people to try to quit smoking right now. If they could cut back, I think that would be excellent. But certainly, you know, those are the patients, the people who are going to want to be very careful about their choice of activities and who they are interacting with in all aspects of life.
As thoracic surgeons, we're always going to advocate for stopping smoking. Now's no better time than the present.
Yes. Well, as we think about how to mitigate the risk of COVID, one of the things that you guys have all said is that just we want to be preventative. I know there's a lot of talk just in social media and around campus, around school, around our communities about masks. So what is your feeling, each and every one of you, or maybe all collectively, on masks?
Wear one.
Wear one?
So, I mean, masks
Put it on.
Yeah, put it on. I think a lot of people have concerns because it's for a variety of reasons. One being the data about the virus and how it's transmitted, and all of those things are certainly, they're unknowns to some degree. And the degree of efficacy that a mask provides, people question. But when we look at, you know, as surgeons, every single day I walk into an operating room, I put on a mask. And I do that to protect the patient from a risk of infection. This is a hospital procedure. This is mandated by the government. Okay, these are things that are evidence-driven for you know, this better part of the century, that we wear a mask to prevent spreading an infection to our patients while we perform surgery on them. So the use of a mask in this setting is no different. The percent reduction or efficacy of the mask relative to not wearing one, I don't know what that is, but it is surely greater than zero. So I think it's got some value to it. You know, the second thing is we hear concerns about, well, if I wear a mask for a long period of time, will I get enough oxygen, or will I have too much carbon dioxide in my blood? And again, all of us wear masks often for 5, 6, 10, 12 hours at a time. And, you know, to date, I have not had a problem with that. And I don't think any of us have. They allow for appropriate amount of oxygen, even to people who have underlying lung disease. There are plenty of surgeons who have COPD or who have asthma, and they are able to wear masks all day long and do operations. So the downside is basically zero, and the upside is you don't get COVID. So I would advocate everybody wear a mask for your own protection as well as the protection of your loved ones.
I appreciate you sharing that. Of all the questions, that one comes up a lot everywhere.
I think in addition to the masks, though, we really practice all of the recommendations. We sanitize our hands every time we walk into a building, every time we walk in or out of a patient's room. We follow guidelines about the number of people on elevators. So, here in some of our buildings, it's only 4 people. So a lot of times that means someone gets off the elevator and takes the stairs when there's someone who can't do that. And I think that, you're protecting yourself, but you're protecting other people as well. And that's really the key thing.
I would add actually that Keck has been wonderful about making it easy as well. All our portals of entry have the ability, we get screened, they have the ability to hand out masks and also all the things to keep our hand sanitized, et cetera. So the system has done a great job in sort of facilitating the promotion of that well-being.
I agree. It's been really, really, really easy to get everything that you need here to keep everybody safe and yourself. So I'm proud to be part of this organization.